So hello everyone. Today, actually in the previous video, I just mentioned lots of strategies how to deal with the viral infections and pharyngitis and the ILA symptoms. So I also talked about the self medications. No, it's causing harm. It's causing more harm than good. So basically speaking, in this video, I promised you to just tell you some lectures regarding some misconceptions regarding the cups and cough syrups. So I'll just tell you regarding that. So basically speaking, what is cough syrup? What is cough? You must understand this. So cough is a thing which is voluntary or semi-voluntary or involuntary. No, is the throwing out effort like from your pharynx. So suppose you're having pharyngitis, you are having some kind of things like some itchy sensation in your pharynx. There is some positive information going on inside your pharynx, and the pharynx will that positive information inside your pharynx will cause some sorts of semi-voluntary or involuntary expiratory effort that causes you to just just throwing things out like whatever just there just stuck inside your pharynx. You just want to just throw it out with some same boundary effort against as just a transitory closed glottis, because this is the definition. But you must understand thing first of all why there is transitory closed glottis, because if you have a cough and if you just start to cough out, and if the glottis is not closed, if the glottis is open, then you have chance of having aspiration, right? So basically speaking, the aspiration is quite dangerous, all these things. Aspiration, this called the aspiration pneumonia, like the things known as Mendelson syndrome, all these things in anesthesia. just just know all these things. I'm not going to details, but what I'm telling is that this same or involuntary or voluntary expiratory effort is called as the cough, and the cough is very benign things. Cough is a symptom, cough is not a sign. Okay, so whenever you are whenever you are just coughing, okay, then always cough just just in between just your arms, just in between your arm and forearm, because there's an actual way to put out the handkerchief and the scarf on it, and then the germs will just spread around and will just affect others surrounding you. It's not good at all. It's not good practice. It's not health hygiene maintenance. Okay. So locally speaking, what I want to tell is that always cough in a proper manner, and there are many cough syrups available in the market. I will just discuss regarding that. So generally speaking, there are some variants of cough syrups, some cough syrups which are banned, some cough syrups which are abundant, some cough syrups which are available at very low cost, and some cough syrups are there at high cost. So which one is to choose and which one to just take, which one to consume, you must not know those things. So basically speaking, I will just give the lecture regarding this. So this is the medical knowledge channel, medical discussion, and if you have any further queries, you can just comment down below. So regarding the problems in the practice, I will just deliver the lecture regarding this. So the cough syrups, and basically speaking, the cough syrup. What is the cough syrup? Cough syrup is a kind of mixture, linctus, like that. Previously, we used to have cough syrups based on glycolic extract, ginger extract, or some sativum extract. Okay, it's called as tulsi. Okay, there are many herbal cough syrups also there, and actually those things also are good. You must not think that the allopathic cough syrups are better. Obviously, herbal cough syrups do wonders sometimes. It's miraculous, but people have some misbeliefs that the allopathic medicines are very faster and also very rapid things, but there are also side effects. You must understand this. So basically speaking, I'm an allopathic practitioner. I must tell that homeopathic medicines are very good in effort, very good in the functions also. But allopathic medicines you have to consider sometimes when the homeopathic medicine cannot discover all these things. So basically speaking, I just tell you the one thing, that the cough syrup that are available in the market, there are lots of cough syrup which are banned. You must not take these things because these cough syrups are quite harmful for your health, and there are cough syrups like the Torex or Corex or all these things. You must know what cough syrups works when. So if you have a cough like the blood cough, like you have some sort of sputum inside, like very chunky sputum, you just can't throw it out. So basically speaking, you must need some sort of things which will just liquefy it. I mean, it is a solidified chunk of mucus that is just inside your pharynx that needs to go out, but your pharyngeal reflex that's originating from your middle oblongata, you just can't throw it out. So basically speaking, you need to throw it out, you need to throw it out, and you need to throw it out. How to throw it out? You need to throw it out by doing some sort of actions on it. You need to just liquefy that chunk of mucus first of all. How to liquefy it? There are medications for that, like the Donald Alpha. Things like bromhexin is there, the active principle of bromhexin, the ambroxol is there. Okay, there is things like acetylbrofylline. Okay, like acetylbrofylline is the thing which is the combination of the ambroxol and the is ambroxol and theophylline. Okay, this acetylbrofylline is a fancy name. Is this actually is just given to that to this medication? Just all these generic names I'm just telling you. I will not tell you any brand name or any proper brand name here because this video is not sponsored possible, and I don't want any brand name to highlight here because actually by the generic I'll go. I'll not tell you any brand name properly. So specifically speaking, the cough syrups, there are lots of variants like the cough syrup for the productive cough syrup for the dry cough syrup for the nocturnal cough syrup for the barking cough, for the bovine cough, okay, and even for the hiccups. So basically speaking, I just went through many medications and I see that cough syrup is very much kind of misconception between the people. So I will just deliver the lecture regarding this because there are lots of misconceptions floating around the people's head regarding this cough syrup uses. They often misuse it because some cough syrups cause, you know, they use it for the treatment of insomnia. Like there are actually there are cough syrups containing terpenadine or cough syrups containing things like phenyramine or chlorpheniramine. Okay, like some cough syrups containing this opioid analgesic like triptorelin. Okay, some cough syrups contain things like I mean noscapin. Okay, noscapin is a composition, something like buprenorphine or butorphanol, the betajosin. Okay, these are the fancy names are given, but they are used sometimes to treat insomnia. But generally speaking, it's not the insomnia that I'm just going to just tell. It's not the insomnia at all. But insomnia needs to be treated with the proper medications. You need to just adhere to the proper guidelines. But the cough syrup is not a solution to treat insomnia, first of all. So here, regarding the cough syrup for the dry cough, there are different variants. Like you can try the opioid analgesics, or you can try the dextromethorphan syrups, or you can try things like there they are centrally acting, peripherally acting, like the levodopa benzoate plus chlorpheniramine and syrup is there, or levodopa benzoate syrup is there also, or dextromethorphan syrup, dextromethorphan hydrobromide syrup is there. Okay, there are syrup like I mean beta-amyloid citrate syrup is also there. It's very new, it's very recent, also good for asthma. Also, you can try cyproheptadine or fexofenadine syrup or montelukast syrup, or also you can try with combination like a montelukast plus bilastine or something like syrup containing dimetindene malate, something like cyproheptadine, something like chlorpheniramine malate. All this is there, but if I going to tell you all the names, you'll just get over around because it's not good at all. But what is needed at it, that's I just deliver this lecture. Thank you.